Welcome to another episode of the Trans 101 series. Today I'm going to be talking to you about the dangers of hormone replacement therapy. This is a very important topic to talk about in the Trans 101 because a lot of parents, friends, family members, acquaintances, all of the above, even trans people are scared and don't know what are the dangers of taking testosterone. What are the dangers of taking estrogen? So in this video, hopefully I can give you some information and clear some of the misconceptions and myths that you might have. I'm gonna start with testosterone. So I have made a video in the past about the changes of testosterone and hormone replacement therapy and what happens. If you'd like information on that, I will link you to the video in the description below. But right now I'm really just gonna focus on maybe the more negative aspects of hormone replacement therapy. So some of the more negative associations with the changes in testosterone are mood changes. A lot of people aren't able to cry, and a lot of people are more angry and need a place to release that anger. There is hair loss, there's acne, and there's weight gain. One aspect that I wasn't aware of is that if you have migraines before hormones, going on testosterone may increase your migraines. The reason why is because migraines are usually more frequent when you have your menstrual cycle because the estrogen levels go up and go down. So because you're going to be on testosterone, when you are taking your dose of testosterone, your testosterone levels go high and then they go low. And then you go high and then they go low because every dose you're kind of going high, but then it drops and it goes high and then it drops. So because of that hormone fluctuation, migraines may be more common if you've already had migraines in the past. But testosterone does not cause migraines for people who have never had migraines in the past. And please remember that everything that I'm saying is usually what happens. Not every single trans person who is on testosterone will experience these, but I'm just giving you kind of a broad understanding and information about what usually happens. So when a person takes hormone replacement therapy, like testosterone, they are now at a higher risk of any cardiac issues. And the reason for that, all right, is because you have a higher testosterone level in your body. So your risk of any heart or risk of cardiac issues is now the same level as cis men. And by that I mean heart attacks and stroke, which is one of the reasons why when you go to your appointments, your doctor usually tells you to stay away from red meat and stay away from cholesterol. You're trying to lower those down, but they say that to cis men as well. So because your testosterone levels are now higher, you are now at a higher risk of any cardiac issues. But usually you have to look at the men in your family. So your father, your I was gonna say nephews, your uncles, your grandparents, if they have ever had any cardiac issues, then you're at a higher risk. But if you have no cardiac issues in your family, then the risk is minimal. But still a good idea to stay away from a lot of red meat, from smoking, and from cholesterol. Once somebody is on testosterone, your red blood cell count really increases, which is a great thing because you're able to have more energy. You can run up the mountain and be less tired than you were a month ago, which is fantastic. But there is some negative association with that in that your blood becomes thicker. And this is very rare, but it can happen. Because your blood is thicker, you can have a condition where your blood clots, which is dangerous, obviously. But this is very rare. I have never heard of this happening, but it's just logical to think, oh, your blood is getting thicker. That is usually associated with blood clots. But like I said, once again, I don't want to freak anyone out. This is a very rare thing. You can actually check that at the doctor to make sure that your blood isn't too thick. But usually, from what I have heard, if your blood count, your red blood cell high is too high, your blood is too thick, the way to fix that is to donate blood. The next aspect is atrophy. So when we talk about the vaginal canal and we're talking about the reproductive organ and all of that area down there, estrogen really helps to plump up and to make everything like nice and good down there in terms of moisture and in terms of density. When somebody goes on testosterone, it's basically like you're going through menopause. So everything kind of dries up down there. And it's not completely dry. It's not like crazy dry. No, there's still some moisture down there. You can still get wet, but you just get wet a little less. The reason why I'm talking about this is because atrophy happens, which means that the lining of the walls get thinner and they become more delicate and more sensitive. And it's not sensitive in a good way. Ooh, it's so sensitive, it's good. No, it's sensitive in a bad way, where there is a higher increase in the area area bleeding because of the friction. And this causes a lot of irritation when somebody is having sex, which is one of the reasons where if you are on testosterone and you do get penetrated, it is a very good idea to use lube. And I would say use a lot of lube just because lube is great and you should just use it all the time. And you should also use protection. And the reason I'm saying that is because scenario, you are getting penetrated, all right, and it's great and you're having fun, but you didn't use that much lube. So the walls, because they're not as moist as they should be, they're kind of breaking down, right? The density, not too much, they're very sensitive, so they kind of break down and lesions can happen and bleeding can occur. This is dangerous, and why? Because when you're having sex and there's blood and there is semen and things can happen, what happens? There is a higher risk for STI and HIV transmission. So I don't wanna like make a joke and like talk about this slightly. This is very serious. There are a lot of issues with atrophy that many people don't know about, but it does cause bleeding. Some trans men and other non-binary folk who have been on testosterone have complained that they bleed after sex, after being penetrated, and it's uncomfortable and it's not fun. Well, using lube and using protection is a great way to reduce the risk of transmission of STIs and or HIV, and it is also a very good way to kind of not reverse the effects, but kind of go away from, I don't know the words I'm looking for, not bleed basically is what I'm saying. As somebody who has experience with this, I can say that it does work. It doesn't work every time. I have bled in the past when there was lube, no idea why. I think it also is associated with if you're having harder sex, then the walls can break down a little easier. And it's not that it's super painful, it's just dry. So it's like a dry pain. I'm sure you can imagine in your head. It's not very hard to picture in your head what that would feel like. So the last aspect that I want to talk about regarding testosterone before I move on to estrogen is cancer. Now there is a very large myth in this community and outside that going on testosterone will cause you cancer. You will develop cancer, and more specifically ovarian cancer or cancer in the uterus or anywhere in that area. It was recommended in the past from doctors even to get a hysterectomy, which is the removal of the uterus. Well, it's actually a total hysterectomy with an oophorectomy, so the removal of the uterus, the fallopian tubes, the cervix, and the ovaries, removing all of that within 2 to 5 years of starting testosterone, just in case. Just so that you don't develop cancer. Well, they have soon done studies on this and have realized that that's not the case. Testosterone doesn't actually cause cancer. But I will say that if you are on testosterone, all right, you do have a higher risk, okay, of not detecting cancer if you don't get checked. So that's the only thing. It's not because you're trans, because you're on testosterone, you're gonna get cancer, you're at a higher risk. No, but I will say that if you don't get pap test and you don't get pelvic exam and you still have all of that in all of those organs down there, you should get a hysterectomy or you should get checked, because there are some things that you might miss, right? You might miss precancerous cells that may develop later on into cancerous cells that you need to remove. But this could also happen to non-trans women as well. But also, if you are on testosterone and you do get a pap test, some doctors might miss precancerous cells because they don't know what to look for, especially if you're putting in the diagram that you're male or female and they don't know which hormones to look at, because testosterone can give you a reading of like an abnormal reading in your pap tests. So those are just the things that you have to be careful for, and make sure that your doctor is aware of these things, that testosterone can give you a abnormal reading, and that you, as yourself, you should be aware that if you do not want a hysterectomy, then you should get a pap test and a pelvic exam every 2 years. Or if you don't want to get a pap test or a pelvic exam, then you should get a hysterectomy, because it, honestly, not that I'm saying it's dangerous, but you're not checking yourself, you have the same risk that cis women would have. And one more thing, sorry, even if you have had top surgery, it is a good idea to still check for lumps, because not all top surgeries remove all of the breast tissue. They masculinize your chest, right? So you need to keep some tissue in order to still have pec muscles and like an area that looks like a pec instead of it more being concave. So checking out for lumps is also a good idea. All right, now let's move on to hormone replacement therapy when we're talking about estrogen. Everything that I'm going to be talking to you about in regards to the risks are basically the same risks as if a cis woman was taking birth control. So if you look at the pamphlet of birth control, they always talk about how if you smoke, you have an increased chance of developing blood clots. Same thing here. And these clots are usually associated with pulmonary embolisms, heart attacks, and strokes. With estrogen, you feel more emotion. I don't know if that's a negative side effect or not, but I'm just letting you know. That's the thing that happens. Same thing as testosterone. If you had migraines before starting estrogen, now that you are on estrogen, because of the fluctuation of estrogen in your body, your migraines may get worse, or you may get more of them. But estrogen does not cause migraines in people who don't have migraines. So a lot of trans women who take estrogen also take another medication called spironolactone to suppress T. This medication is actually also used to lower blood pressure, but it somehow also suppresses testosterone, which then decreases the erectile function. But this is a medication that is used at the same time as estrogen to suppress the testosterone, because testosterone is very aggressive and very strong in the body. So sometimes taking estrogen isn't enough to suppress all of that testosterone. So taking this extra medication will help suppress it even more. So some doctors are hesitant to give trans women or trans feminine individuals looking for estrogen their prescription if they have a history of cancer or blood clots. With that, you would just need to do more tests with the doctor and talk about the possibility. And if you smoke, you'd have to stop smoking. Some doctors actually require you to stop smoking in order for you to go on testosterone and or estrogen. Loss of erectile function can happen. That could be a good thing for some people. That could be a bad thing for others. And interestingly enough, I did not know this, and I don't think that this is a negative effect, but it's very important to know. 10 years after you started estrogen, you've been on estrogen for over 10 years, it's a good idea to think about getting mammograms, because you're on estrogen for so long that you have developed breast tissue. And if you think about it, not only cis women get breast cancer, right? Cis men also get breast cancer. So not that I'm saying trans women are cis men at all, I'm just saying everyone can get breast cancer. So it is a good idea after you've been on estrogen for a long time. But if you started estrogen when you were in your teens and now you're like 26, you don't have to start thinking about it now. I'm more talking about if you were like in your 30s and you started estrogen and now you're in your 40s, it's a good idea to start thinking about mammograms, maybe start talking to your doctor about that. All right, that's all that I can think of for now, all right? So I wanted to give you the dangers and what the negative effects of hormones can give a person who is on hormone replacement therapy. Hopefully I answered some of your questions and debunked some of your myths, especially the cancer myth related to testosterone. That is a very big myth, which I actually look more into when I talk about hysterectomies, which I will link in the description below. If you have any questions, please let me know. I look forward to reading your commentary below, and I hope you have a great day. I'll see you later. Bye.